Hello everyone and welcome to the final event of the Chemin Innovation Series, Mum and Baby, from prenatal to preteen. My name is Nick Taylor and today we will be discussing the latest markets insights on early life nutrition and the unique benefits of lutein and zeaxanthin during pregnancy. Our speakers today are Ira Walterscheid-Muller, Segment Lead for Early Life Nutrition in EMEA at DSM Nutritional Products, Lisa Renzi-Hammond, Assistant Professor at the University of Georgia, Naiman Khan, Assistant Professor at the University of Illinois at Urbana-Champaign, and Samantha Machi, Senior Technical Manager for EMEA and LATAM at Chemin. Just before we get started, I have some housekeeping items to go over. If you have any questions for our panel, please type them in the Q&A box below and hit the submit button. We will answer as many questions as time allows. Also, the video feed won't display in the audio-visual box until the Q&A to prevent technical issues during the presentations. Okay, with that cleared up, I would like to hand off to our first speaker. Ira leads DSM Nutritional Products Early Life Nutrition segment in EMEA, giving her responsibility for preconception until 12 years of age. Ira is particularly passionate about the first 1,000 days. Ira, you have the floor.
Thank you, Nick. I'm really excited to talk today about the importance of nutrition during early life. Actually, early life is for DSM a highly purpose-driven segment because we talk about pregnant women, infants, and kids. Therefore, our mission is to develop safe and science-based solutions that meet the consumer needs and requirements. Therefore, I will start this presentation by sharing some consumer insights before I talk about nutrition. And last but not least, I have also some innovative concepts to present. As said, at DSM, we regularly conduct consumer insight studies. So in the early life space, we have done 3 in the past years. In 2019, we conducted a global health concern study where we talked with parents about their kids from 0 to 16 years. Then we conducted a U&A study where we talked about maternal, infant, and toddler nutrition. And last but not least, in 2018, we had a global kids study where we talked with mothers of kids between 4 and 12 years. We have a lot of data available, but just to give you a high-level overview about the health concerns. So on the top, you see the health concerns of moms-to-be, and the number 1 answer is to get enough sleep, followed by getting enough vitamins and minerals. However, if we talk about them or if we ask them what the main concerns for their children are, they get more specific. So the number 1 concern is to develop a strong immune system, followed by ensuring a good brain development. We see similar results in the second study that we conducted. So parents of children between 0 and 5 years say that they care most about the immune system, followed by eating well. And these are the so-called picky eaters, and I will talk about this later on. And then we have the brain development and protection against diseases later in life. Parents of older children between 6 and 16 years, for them also the immune system is the main driver or the main concern, followed by mental and emotional health, eye health, and not eating well. So again, these picky eaters. And then we have a healthy brain development and protection against diseases later in life. This brings me then to the proper nutrition during pregnancy and childhood. So we all know how important the first 1,000 days are. It's a unique window for nutrition and sets the stage for a lifelong health because actually growth will never be faster and therefore the proper development is critical. So during pregnancy, there's an increased requirement for micronutrients such as DHA, vitamins and minerals, and iron and folate. But there's also emerging science that lutein supports the brain and visual development, and my colleagues will talk more in detail later on. So lutein can support during pregnancy and lactation. But also during childhood, nutrition is critical because kids are not just little adults, so they also have increased requirements for a healthy development in terms of immunity and also cognition. So also these years set the stage of a lifelong health and a well-being. So also here we have an increased number of studies that show that lutein will improve the brain development and also improve the academic performance. So below you only see a couple of studies on it. And again, my colleague later will go more into detail. Talking again or coming back to the topic of picky eaters, so that's definitely a concern about on a global level, and many parents of us can confirm that it's very difficult to include dietary sources of lutein in the daily meals, and therefore fortified food and fortified food supplements can clearly support. And therefore, I'm very happy to share some of our maternal and kids concepts. So first of all, we have developed a kind of gummy application. So on the left side, you have a health benefit focusing on cognition and vision, where we include DHA, but also lutein and zeaxanthin. And on the right side, that's a combination between immunity and cognition, where we add DHA, lutein, vitamin C and D, but also HMOs and probiotics. And if we then move into a maternal supplement, we have here a capsule with a high inclusion rate of DHA, but also lutein, vitamin D, and probiotics. And then really depending on what type of target area you're looking at, what type of application, we have many more concepts available. This brings me also to the end of my presentation. So if you want to discuss further concepts and innovations, please feel free to reach out to me. Thank you.
Thank you, Ira, for that insightful presentation. As a reminder, if you have any questions for our panel, please type them in the Q&A box below. We'll now move on to our next speakers, Dr. Lisa Renzi-Hammond and Dr. Naiman Khan. Lisa has spent the past 18 years studying the role of carotenoids in the visual and nervous health system across the lifespan. Naiman has generated foundational knowledge in nutritional neuroscience by translating the impact of health behaviors to childhood cognitive function, leading to more than 70 publications. Lisa and Naiman, take it away.
Thank you so much. I am delighted to be here. Thanks to Ira for setting us up so easily to go into some of the science behind those concepts that you presented. It's a really tremendous pleasure to be here today presenting alongside a dear friend and dear colleague. So you'll hear us kind of riffing back and forth a little bit. You'll hear my presentation move into Naiman's. But the most important thing to emphasize here is that we love questions. So please do feel free to blow up that Q&A box. We're looking forward to hearing what you have to ask. So my goal today, you'll see that Naiman and I are kind of splitting up some of this content. My goal today is going to be to focus on the earliest of early life. So you might notice in my byline there that I'm part of an Institute of Gerontology. About 60% of my research is on older adulthood, and we could do an entirely different lecture series on that. But today I'm going to focus on the 40%, which is building the sort of healthy brain that can take a person throughout the entire lifespan. So let's dig in. So the first thing to say is that I think we all need to pause for a minute and really deal with our concept of nutrition. So we talk a lot about nutrition. You'll hear people, consumers use words like a healthy diet or lots of nutrients without much clarity on what those terms even mean in the public space anymore. So nutrition all foundationally begins with food. And if we ask the question, what is a food? I think we find that to a lot of consumers, there is a real conflation and a difference in opinion of sort of whether or not a food is important or whether or not it's the nutrient that's important. Because of course we can achieve nutritional supplementation and really boost our nutrient status that way. But of course, the situation gets a little bit more muddled when we start even thinking about how we have adapted foods over time. So there's, nutritional supplements, there's medical foods, but there's also just foods that consumers buy. And what you'll notice is that the foods on the right don't look a whole lot like the foods on the left. I mean, when in the history, of our dealing with food, have we ever had to specify something as organic before? Or mention the fact that our juice is 100% juice because it's truly the case that it might not be anymore. So we're a little confounded, I think, on the concept of food. And I think along with that, we always ask questions. This is one of the ones that I get most frequently. Like, okay, what should I be eating? Is there anybody who's got it right? Is there an ideal diet out there? And the answer to that question is yikes, and not really. There's lots of different ways to achieve a really wonderful nutrient-dense diet. But one group that I'm going to point out here is the Chamane. So the Chamane are a group of Bolivian forager horticulturalists who eat a pretty darn pure diet. And so one thing that is true about the Chamane is that they've been studied pretty extensively over time, because we don't look at the Chamane and see the sorts of things that I study at the end of life, right? We don't see a lot of Alzheimer's disease or heart disease or diabetes or modern health concerns. And if you take a look at what the Chamane eat, it's very different from this. So Time did a beautiful series on what we eat all over the world and how much we pay for it. And as you're looking at these images, take a look around that sort of picture. If you're looking for the food, right, the fresh fruits and vegetables, the unprocessed pieces, it's sort of like an eye trick. It's a little bit hard to find. It's right there in the middle. But this is really typical of the United States, where about 65% of what we consume is processed. It doesn't look like the apple. It looks like all the other stuff on the right of that image that I showed previously. Now compare that against this family in Mexico. You can see a lot more fresh fruit and veg is under the picture. There's still a lot of sugar-sweetened beverage in the back, but you can see that there's a real difference just by going a little bit south of the United States border. Now go over to Sicily, right? Here's a Sicilian family, and you can see lots of sort of fresh fruit and veg in there as well. Fewer sugar-sweetened drinks, lots of bread and bread products. Now let's take a look at this family in Ecuador. We could say a whole lot about food prices and family sizes and things like that, but you can see that global diets really do vary. Is there an ideal diet? It's going to depend a little bit on where you live in the world. When we start talking about moms, though, when we sort of hit this topic very, very early in life, these are data from the United States. And if you take a look at this graph, you might look at it and say, maybe this is the percentage of women who aren't meeting their guidelines, because the graph sort of peaks out there at about 35%. Unfortunately, this is a graph of United States lactating women who do meet their dietary recommendations. And if you look at that vegetable column, which is going to be really important because, as you heard, we're going to be spending today talking about lutein, zeaxanthin, their isomers, which are found in dark green leafy vegetables. 1.1% of the women in America who are lactating are actually meeting their dietary intake guidance. So one big question for us is, what is the impact of this on biology, right? How does this dietary situation actually impact development and maternal health? When you consider that we make really trite statements like, oh, well, you are what you eat. We say things like that all the time, but it absolutely must be true. If you siphon the water out of the central nervous system and you're looking at brain tissue, 60% of what you see is fat. In biology, we have a sort of almost a law that's structure dictates function, right? You really can understand what a molecule is doing in the body if you know what it looks like and how it's built. And I don't think any of us would for a moment say that something like olive oil is structurally all that similar to something like clarified butter, right? They're just not the same thing. So if you are what you eat, literally, then, the sorts of things that we actually consume will change the structure and therefore the function of things like the nervous system that incorporates this nutrition. So as an example of that, let's go back to the Chamane and compare women from the Chamane against the United States and Canada. And if you take a look, let's look at the sort of yellow bars down at the bottom that I've just highlighted with that box. If you take a look at there, those are the long chain polyunsaturated fatty acids that we are so deeply concerned about for health, for neurological development, for things like that. You can see that there's vast differences there between the Tsimane and women in the US and Canada, right? And I haven't told you the substance that's been measured in this case yet, and that is of paramount importance. What you're looking at is fatty acid composition of breast milk. We say you are what you eat, but we have to recognize that baby is what mom eats. So let's really dig down into the nervous system and see how these nutritional choices, the availability of healthy foods, access to things like nutritional supplementation really impacts the nervous system. So the best way to start this conversation is really by digging in and saying, all right, what is a brain made of, right? If you were to take a little scoop of brain and chuck it in the blender and break it apart, what would you find? And the answer is, of course, that you would find a significant amount of fat, and which types of fat we tend to load preferentially does depend a little bit on what's available to us in the bloodstream, what has come in through diet. We see vitamins, fat and water soluble in their respective compartments, and nervous systems are really profoundly picky. If I had a theme of today, it would be that the brain is picky. It likes specific conformations of specific molecules. For example, the brain tends to load a lot of vitamin E, but it doesn't load every possible configuration of vitamin E. It prefers the configuration of vitamin E, the sort of 3R natural form of vitamin E that's found in foods, not the form that tends to be found in dietary supplements. There's electrolytes in ion channels that are actually sort of facilitating action potentials. There's proteins, carbohydrates making up the cytoskeleton and receptors. I mean, truly, neurons that compose the brain are made of nutrition. So today we're focusing on carotenoids. What about those? Well, Ira did a nice job of introducing the concept. Carotenoids are basically plant pigments. There's 700 different carotenoids out there in nature. But of course, we don't actually do a lot of scavenging in nature for our food. I do a lot of scavenging at the supermarket, as do a lot of people. I don't really have access to the 700 possible carotenoids that are out there in nature, coloring our plants and giving us things like beautiful fall seasons. Rather, because I scavenge in the supermarket, I have access to about the 50 or 60 carotenoids that tend to be concentrated into foods that are easily grown with modern high-yield agricultural practices. Now, of those 50 or 60, if you were to look in my blood, you'd find about 20 or so of those carotenoids. But when we start looking in brain tissue, and I would like to posit for you today the idea that retina is brain, right? It's a little detached piece of central nervous system tissue that's pushed forward in space that we can actually kind of look at. When you look in retina, you don't see those 700 different carotenoids that are in nature, or the 50 or 60 in diet, or the 20 or so in serum. You see lutein and zeaxanthin, right? It's lutein and its isomers that are really concentrated into that tissue to the exclusion of everything else. So one might ask the next question, okay, developmentally, when is this process happening? We understand that if a molecule is loaded up to the exclusion of other things, and Naiman's going to give us a little bit more insight into that coming up in a few minutes, we tend to think that molecule must have some biological importance. So what's up with that, right? When does it start happening, and what's going on with that? So if we take a look, you're looking at different carotenoid concentrations in maternal serum and in cord blood at various time points. So this is first trimester through postpartum, and then, actually analyzing cord blood itself. When we take a look at these various, at blood over the course of pregnancy, you can see that in the beginning, lutein is not the dominant carotenoid. And again, this will depend a little bit on maternal diets. And we'll get into that a little bit more in just a minute. In the United States, this would absolutely be true, that you wouldn't expect to find lutein as the dominant carotenoid. But look throughout pregnancy, right? I would love to believe that it's the case that, all the moms of the world are dramatically changing their diets during pregnancy, but we know that isn't actually happening in a lot of cases. So you can see lutein just sort of going up and up and up in mom's serum. And if you take a look at cord blood, you can see that lutein is sort of head and shoulders above the other ones. So what is this process? Why is this dynamic process happening? Even if it's the case that mom is not actually consuming more lutein than, say, lycopene in her foods. So let's look at another snapshot here before we answer that question. Let's look at the next step of delivering lutein. Now we know it's the dominant carotenoid in cord blood, that mom is really working hard to make sure that this molecule is being delivered. Let's take a look at human milk. So if you take a look at those panels, each one of those panels is a different carotenoid. So we've got lutein on the top left. We have beta-cryptoxanthin on the top right. We've got lycopene on the bottom right and beta-carotene there on the bottom left. These are moms from China, Mexico, and the United States. United States is in blue, Mexico in green, and China in red. So if you're looking at this graph, what you might notice is that lutein levels tend to be higher, for example, in that top left panel in moms from China, whereas, if we take a look down at lycopene, not surprisingly, you'd say the United States is sort of way up there at the top. So if the only thing that you took out of this graph is that there are cultural differences in terms of carotenoid consumption and therefore expression in human milk, that's an important take home, but it's actually not the most important take home. If you look at the y-axis of every one of these graphs, you can see that the beta-cryptoxanthin, the lycopene, and the beta-carotene all top out at 150 nanomoles per liter. Now go look at lutein in the top left. That graph actually tops out at 500. So if we were to plot all of these on one graph, lycopene, beta-cryptoxanthin, and beta-carotene would all sort of be down at the bottom, and lutein would be head and shoulders above in the top. Mom works very hard to get this to baby, not only through cord blood, but in human milk. So where does it go when baby's consuming it? Well, it doesn't just go to retina, that little accessible piece of brain where lutein and its isomers are the only carotenoids in there. It also goes into the rest of brain tissue. And you can see that, again, despite the fact that it is not the case that the moms of the world are necessarily eating more lutein than, say, lycopene, right? It's that lutein is the one the brain is actually picking. So there are some selective methods of getting lutein up into brain tissue. And in this particular study, there was only lycopene found in 2 of the decedents. It's just not a dominant feature of brain. So for whatever reason, right, and we're going to get into some of those reasons in just a moment, the brain really does seem to prefer lutein. So how can we influence the amount of lutein that an infant receives? Well, one great way is to supplement mom. So this was a study that we did back in 2014, and you're looking at placebo in white, a low dose of lutein in gray, and a high dose of lutein in black. And you can see that in that final panel, you can see the trajectory of change over time. You can see that it's pretty easy to supplement mom and actually change not only mom's lutein levels, but change the amount of lutein that infants receive. Mom is one of the best dietary supplements herself that you could imagine. So why lutein so early? Why this particular molecule? Well, first thing to say is that lutein's an antioxidant. This is one of its better known functions. So molecules like DHA that we just spoke about, sort of wanting to get into baby's central nervous system, have lots of double bonds in that sort of long tail. And it's a great fluid fat. You want to load it into brain, but of course it's also really susceptible to oxidative damage. So when we add lutein into that mix, right, what we can do is sort of block that oxidative stress phase and release some of that excess energy as heat. So it's a great antioxidant sort of wherever you put it, but that's actually not the only thing that it does. In retina, lutein also absorbs light. So you're looking at the same slice of macaque retina, and you're looking at 3 different lighting conditions. So in the top, it's a broadband white light. In the middle, it's a shortwave blue light. And in the bottom, it's a midwave green light. And what you can see essentially is that in retina, lutein is absorbing specifically that shortwave blue light. So I want to bring out a little situation here for everyone to think about. We know that lutein is preferentially delivered extremely early, but there is a maturational process that has to take place to get lutein into retinal tissue. When we try to measure lutein in preterm infants, this was a wonderful study that attempted to do that. You can see that we don't find lutein in the preterm infant. This seems to that sort of maturational process where the retina sort of adapts to be able to hold lutein seems to be a 3rd trimester phenomenon. So when infants are born preterm, right, they haven't gone through that maturational process yet. One of the things that is often also underdeveloped on preterm infants is lung tissue. So we often put infants in high oxygen environments. We use blue light to break apart bilirubin in tissue, and we have a recipe here for retinopathy of prematurity. So having lutein in there, actually being able to provide lutein to infants as early as we possibly can is a very good idea. So in addition to being protective, lutein also improves visual function. So these are tests of infants that were conducted by our laboratory group, where we're actually looking at the sort of blue light situations that we encounter outside all the time. When we look at an infant's ability to determine contrast, right, to see objects against that bright blue sky sort of background, one thing that you can see if you're into stats is that infants have the same improvement in visual function that adults do when we test them. So lutein improves their ability to actually see in those challenging outdoor conditions. Now, recent research has also shown that lutein is associated with visual acuity. And you may be tempted to immediately say, oh, that's because it absorbs blue light. But actually, I'm not entirely sure that that's the mechanism. There's not a whole lot of blue light in an image like this, right, in an acuity chart that we actually use to look at pediatric patients. What we think might be happening, rather, is a maturational issue. So in non-human primate models, for example, one thing that you can see is that when non-human primates are raised on chow that doesn't actually have any lutein in it, we see anatomical differences in tissue structures like retinal pigment epithelium. So you can see the red line there is non-human primates that have not been exposed to a lot of lutein in their diets, and they've got this excess little clump of cells that really don't belong in that tissue. So lutein may actually be impacting maturation of the retina, which can therefore impact acuity, in addition to, improving vision in sort of blue light conditions as well. Now, to lead us into what you're about to hear from Naiman, processing speed is also profoundly important. And this is another thing that lutein impacts. So we've been able to build technology and take advantage of things like preferential looking techniques to actually see what sorts of processing speed situations an infant can perform in. In other words, can they still resolve quickly moving images, even when they're moving way above threshold? And the answer is that when we take a look at infant processing speed ability, it really tends to change with mom's lutein levels. Now, this is still a study that's ongoing, but so far what we've seen is that when we look at mom's lutein levels, so the amount of lutein in mom's nervous system, and we look at baby's processing speed, the more lutein mom has, the faster baby is able to process information. So to sort of spoil what's coming next for you, why is processing speed important? It's hard to measure cognition in an infant, but processing speed is a wonderful biomarker of it. When people are able to process information quickly, right, they have longer time to act on it, and we see cognitive functional changes predicted by something like processing speed. So I want to segue us into Naiman's presentation with just a little reminder here. And that is that when we talk about things like nutrition, inevitably, this is a conversation about diet. It's not just a conversation about nutritional supplementation. So Time also did a spread on children. And if you're looking for the fresh fruits and veg in that image, but you're seeing lots of white bread and refined pastas and things like that, you're pretty accurately capturing the diet of a lot of children. If we look at the United States and we're looking at lutein intake across the lifespan, just a reminder, this is in micrograms. It's not until adulthood that humans in the United States, at least, tend to consume even a milligram of lutein. If someone's consuming a good cup of cooked spinach a day, they should be getting about 20 milligrams of lutein and its isomers. But on average, most people only get about 1.5 milligrams, which means that our next chance to catch up on lutein is not until profoundly late. So on that note, I'm going to turn the proceedings over to Naiman, who can go ahead and take us a little bit farther into development.
Hello. Thank you so much for having me today. It's a pleasure to be here and speak along, such a wonderful colleague as Lisa. I also want to thank Kemin for hosting this wonderful webinar on a very important topic. Today, my goal will be to provide a brief overview of what we know about neurolutein in early life, and also present to you some information and some findings that we have from studies. Several of them are cross-sectional studies, and also an experimental trial on the implications of retinal lutein for attention and memory in the preteen years. So background, I thought it's best to, in fact, similar to what Lisa was presenting on, just to highlight, I think, what we have as a public health crisis in many westernized countries of a westernized diet that is typically lacking in green leafy vegetables. And while that has been studied extensively for its implications for chronic disease, we are still in the early stages of understanding what that means for important markers of cognitive health. And one place to look at this could be looking at something like obesity rates. In the United States in particular, now we know that about 40% of adults have obesity, and these rates tend to start earlier in childhood and are increasingly tracking into adulthood. We also know that children and adults, as they get older, tend to meet less and less of the guidelines for physical activity, as well as important markers of dietary quality like fruit and vegetable consumption. And while, as I mentioned, these interrelated health factors have been studied extensively for metabolic health implications and weight regulation, we're not quite sure about what this means for children's academic achievement and important markers of scholastic success. So our work has endeavored to examine how certain nutrients, and particularly today I'll be talking about lutein, may play a role in supporting these markers of cognitive health in children. So in background, I'd like to just highlight some important concepts, and I think Lisa already highlighted the key information regarding brain structure and how nutrition plays an important role in virtually all in brain structure, but as well as brain function. What we also want to appreciate when we think about nutrition and its role in cognitive health is that brain development doesn't stop in childhood or early childhood. It continues, in fact, until the third decade of life. And the functional and structural organization of the brain also continues throughout life. So what this means is that it gives us an opportunity to better understand the role of environmental factors and nutrition and other behaviors on cognitive health. This also means that those cognitive functions, for example, attentional control and information processing, that occur throughout childhood, which we know begin or achieve adult maturity at different stages throughout that development period, are coinciding with each other. And what we know is that from an experimental standpoint, these domains of cognitive function could be differentially affected by nutrition depending on the stage of intervention. So the point here is that it's important to appreciate that not only is the brain made of nutrients, but that also that development of brain structure and function continues throughout childhood, providing opportunities for optimizing cognitive function even throughout the lifespan. So what you've already heard a little bit about lutein and as well as other carotenoids. What we do know is that lutein and other carotenoids have long been studied as bioactives, dietary bioactives, owing to their antioxidant capacity, as well as markers of diet quality. Interestingly, relative to other carotenoids like beta-carotene and lycopene, lutein is consumed in much smaller quantities, which only represents about 12% of dietary carotenoids. So among the carotenoids, which we are not really stellar as far as our consumption of carotenoids, lutein is actually one of the lower consumed carotenoids relative to something like beta-carotene or lycopene. However, when we look at data from brain tissue, we see that lutein deposits up to about 60% of carotenoids in brain tissue. And what we also notice when you look at the human infant neural tissue is that the deposition of lutein across many cortices of the brain is oftentimes 2 to 3-fold greater than other carotenoids. So this is just to highlight that while lutein is not a big feature of our dietary consumption, it is a key selectively accumulated carotenoid across brain cortices. We also see this deposition in the prefrontal cortex as well as the hippocampus, which is telling because we know that academic achievement, attention, and memory processes are particularly dependent on the integrity and health of these brain structures. So these are vital data that demonstrate that lutein preferentially accumulates in neurotissue and has the potential to play important roles in cognitive function in children. So while lutein is consistently related to cognitive function in adults, and I'll share some of that work a little bit later, a key question that we have is regarding the mechanisms by which this actually takes place. While it's not really clear yet, since I really do believe we're in the early stages of understanding the mechanisms, there has been some work that has taken a look using an exploratory approach to understand where in the brain lutein may play a role in offering neuroprotection. These figures illustrate exploratory analyses relating metabolite signatures in infant brains and lutein concentrations in the hippocampus and the prefrontal cortex. The figures on the left highlight the correlations between lutein and fatty acids in the hippocampus and the PFC of prefrontal cortex. On the right, you're seeing these relationships to neurotransmitters, and what we see is a consistent positive association, even for important neurotransmitters like GABA. And what we know that these data reveal, and this is in human infants, what we're learning through these data is that this is consistent with the hypothesis that's been proposed based on previous studies that lutein may play an important role in neuroprotection of brain lipids that are particularly vulnerable to oxidation. And these relationships, given that they're observed in areas of the brain like the hippocampus and prefrontal cortex, provide additional support for the potential of lutein to support executive function, cognitive control, all those factors that really make the foundation for children's scholastic success. So you can think of like something like academic achievement. Additional work also points to the importance of early life lutein and the importance of early life and neural lutein. These data are from Dr. Elizabeth Johnson's group examining the correlations between lutein accumulation in human brain tissue as a correlate of STAR3 across cohorts of deceased individuals in different stages of life, including infants versus older adults and very old adults. So some adults of an age of 100 and over. STAR3 is the lutein binding protein in the retina, and it's also thought to perhaps be the lutein binding protein in brain. So what these data were focused on was understanding whether the binding capacity of this protein differs across the lifespan if you look at human brain tissue. And interestingly, what the researchers learned is that there's a much stronger positive correlation between lutein and this binding protein in infancy compared to adults. As you can see that by the gradient of the line in the first figure. Therefore, the capacity for lutein accumulation in brain tissue may be higher during the early stages of life. This is important because it reveals additional information about the importance of early life nutrition and that stage of development where the brain may be in a particularly primed position to accumulate lutein, and it highlights that the importance of that life stage because that may actually influence the trajectory of lutein deposition in brain tissue throughout life. So what do we know about lutein consumption and its effects on cognitive function? Importantly, there is encouraging and high-quality evidence in adults where double-blind placebo-controlled trials have even demonstrated that lutein and zeaxanthin consumed even through supplementation or using foods not only improves macular pigment optical density, which is a non-invasive proxy measure of neural lutein, but we also see benefits in many domains of cognitive function, and we see this across many different functions, including processing speed, attention, and memory. But that's really exciting because now we know in adult studies that there seems to be an important role that lutein and zeaxanthin, from a dietary perspective, may play an important role in macular pigmentation as well as cognitive function. However, this work has, of course, been limited to adults, and there's been very, very little work conducted in children in understanding whether these effects can be observed at an earlier stage in life, and whether consumption of lutein could impact macular pigmentation as well as cognitive function in children. Therefore, that's where we've focused our efforts. Today, I'll just share with you some of the work we did, and the very first study that we did in this area was with Lisa and Renzi-Hammond from the University of Georgia, and really testament to them. This was work that really, the first challenge we faced was a methodological one where we had to ask a very basic question of whether the techniques that are utilized in understanding pigmentation or macular pigmentation in adults can actually be reliably used in children. This is a very important question because, while dietary self-report of nutrition is often utilized, what we know is that it's prone to error. So when you actually study physiological levels of nutrients that we think have relevance to cognitive function, we actually think that information is particularly important in making strong claims about the relevance of those nutrients. So the first question we addressed with our study in this area was to understand whether heterochromatic flicker photometry assessed using a macular densitometer. If you make a modification to that protocol, whether or not that could be reliably done by children. So in this study, what we recruited children between 8 to 9 years of age across 2 sessions. We assessed their macular pigmentation. And what we learned through this process was that children as young as 8 can do this reliably. It's not a great reliability score, but it gave us some confidence in then utilizing this approach to further understanding how pigmentation in childhood could explain some variability in important cognitive functions, but then whether it could also be utilized as a way to measure change in dietary approaches of changing lutein status, so macular lutein status in children. So one of the earlier studies following the reliability work we attempted to understand whether retinal lutein assessed using macular pigment optical density could explain any variability in memory function in pre-adolescence. These figures illustrate the correlations between macular pigment optical density and spatial memory among 8 to 9-year-olds. Importantly, what we learned through this study was that children with greater macular pigment optical density exhibited lower rates of memory error during the spatial reconstruction task. What was also interesting was that these relationships persisted even after we had accounted for previously known important factors that predict children's memory performance, including age, IQ, fitness, as well as total body fat. So we were able to explain the unique variability or independent variability using macular pigment optical density in children's memory function. This is also important data because what we know about spatial memory is that it's predominantly dependent on the integrity and the health of the hippocampus. And we know that hippocampus plays an important role in all manner of memory processes. So it highlights the perhaps important role that lutein may play in supporting hippocampal memory performance, even in childhood. In a subsequent study, we had addressed the question of whether, while we've seen relationships with memory and macular pigment optical density, could we see these relationships also for executive function or attentional control? In this study, this slide illustrates differences in attentional inhibition measured using a flanker task that requires variable amounts of attentional control. Interestingly, children with higher MPOD exhibited greater performance for the task condition requiring greater attentional and inhibitory demands, what we call the incongruent condition, which suggests that children who had high MPOD seemed to benefit particularly from that higher MPOD when the task demands became more difficult or more challenging. Additionally, while children were doing this task, our laboratory has the capability to assess underlying EEG and specifically focusing on what are called event-related brain potentials that tell us about the neural underpinnings of these cognitive functions. So that gives us a sense of, for example, how much attention a child is paying during the task and what the information processing speed may be. So in this, during this study, participants, we focused on the P3 ERP component. That's that positive going waveform that you see that typically peaks in children right around 600 milliseconds. And what we learned is that not only did children with higher MPOD perform better on the incongruent task trial type, they also do so while exhibiting lower attentional resources, so which is suggestive of a higher neural efficiency because they're able to actually have higher accuracy for the task performance that's difficult, while also dedicating less attentional resources to it. So this is consistent with hypotheses that have been made in older populations about the importance, and even younger populations about the potential importance of lutein for neural efficiency. However, while the studies I've highlighted so far provide valuable correlations or cross-sectional support, pointing to the importance of macular pigment in explaining variability in children's memory and attention, what we really need are intervention or experimental trials to understand the impact of these macular xanthophylls like lutein and their impact on cognitive function in children. While we know, and what's been promising is that in adults, it's been shown that the combination of DHA and lutein has shown to improve memory and learning. This is partly based on knowledge that DHA comprises much of the polyunsaturated fatty acids in the retina. We know that the peroxidation of these fatty acids in lipid membranes, for instance, can impact the health of these cells and their function. We also know that DHA has been shown to enhance lutein deposition in the macula. Therefore, based on this adult work, we use a synergistic approach where children were provided with daily lutein in combination with DHA at a lower dose of lutein of just 1 milligrams per lutein per day. This was compared against a cohort of children who were provided with a non-caloric placebo for daily for a 9-month period. We took measures of brain structure and function as well as EEG and macular pigmentation throughout this trial. And this was our first experimental approach of determining whether or not lutein consumption in combination with DHA could impact macular pigmentation and cognitive health in preteens. So while the study's MR findings, so the brain structure and function is still undergoing analyses, I do have some data that I can share with you today regarding a key question. The first question that I think is really important to address is whether or not consumption of lutein as part of a dietary intervention can actually impact macular pigmentation. And what we learned that is the case. Children in the intervention group, as you can see here, exhibited benefits from macular pigmentation over this 9-month period, whereas we don't see that benefit in the control group. In fact, what was interesting is that you see this sort of slight decline in macular pigmentation in the control group, which may also be telling in its own that, you know, sometimes control groups give you really interesting information that tells you about the trajectory of growth in certain domains. And it does look like when children don't get that daily lutein or that additional lutein, you may actually see this trend of declining in children as they get older. But we see those benefits in the treatment where macular pigmentation improved. Additionally, we saw benefits in relational memory as assessed by pattern separation task, which is a measure of hippocampal function. And we also saw benefits in attentional control where children in the treatment group exhibited lower interference post-treatment following the 9 months of intervention relative to the control group. So these findings are the first, and while they're incomplete, are the first to demonstrate that we can improve macular pigmentation in children using lutein in combination with DHA, but also there's some promising evidence that these benefits may translate to improvement in hippocampal function and attentional control. So I'd like to acknowledge here at the end the large group of graduate and undergraduate students on our team that have contributed to this work through various projects. I'd also like to send a special thank you to our colleagues, especially Lisa, for really getting this work going with us. Several years ago, when I was a postdoc, was the first opportunity I had to collaborate with Lisa, and since then we've really not looked back at all, and we've really moved along. And it's been really fun understanding the implication of carotenoids and retinal and vision health and cognitive function. And finally, I'd like to thank our sponsors, Abbott Nutrition, as well as the Center for Nutrition and Learning and Memory at the University of Illinois that supported this research. Thank you.
Thank you, Lisa and Naiman, for that great presentation. I will now hand over to Samantha Machi. Samantha is a biologist by training and Senior Technical Manager for EMEA and LATAM at Chemin. Over to you, Samantha.
Thank you, Nick, and thanks to all the participants. In this last section, I will introduce you to the key features of FloraGLO Lutein and provide insight from a novel research on eye benefit in children. So FloraGLO Lutein is the pioneer of lutein science and discovery, is a free lutein with established reputation for quality, safety, and efficacy. The first lutein introduced in the global marketplace, and Chemin will celebrate the 25th anniversary of FloraGLO Lutein next year, and revolutionize the supplemental lutein market, provided foundation for the advancement in lutein science for human health in areas of vision, beauty, and more recently cognition, maternal, and infant nutrition. 6 pillars characterize and differentiate FloraGLO Lutein: trusted brand with over 20 years of proven safety and efficacy, excellent stability in powder or oil formulation. This allows for lower overages and overall real cost effectiveness, and bioavailability, something that relates with the proven efficacy. These 3 pillars are probably the most important for the current talk today, and lutein has been considered safe for infant nutrition. Only lutein brand GRAS for infant formula in USA, also only lutein brand assessed by EFSA for use in infant formula, establishing the safety. Most studied and most research with more than 90 human clinical trials using the AREDS2 study. so the largest lutein supplemental trial to date, and also the only lutein brand that has studied in pregnancy, breastfeeding, and preterm and term infant nutrition, and the blue light brand. So Kemin owns a patent, US patent, showing how lutein can protect individuals with 3 common ocular disorders, such as presbyopia, hyperopia, and astigmatism, from blue light or light-induced damage associated with sunlight, associated with the digital device. So hyperopia and astigmatism are very common in infants and children, so this is very, very important. And Kemin continues to pioneer science and discovery with FloraGLO Lutein. In recent years, we invested in learning more about how lutein, about how exposure to blue and white light can impact children's vision. So with this last slide, I will share with you the insight for this first and novel research. It's a randomized, double-blind, placebo-controlled study aiming to assess the effect of lutein and zeaxanthin supplementation on visual performance in school children exposed to white light and blue light while reading. So children 8 to 12 years of age, 4-month supplementation with 10 milligrams FloraGLO Lutein, 2 milligrams OptiSharp natural zeaxanthin. And the study provide insights on the effect of supplementation on objective measurements of glare recovery time, subjective measurements of eye strain, eye fatigue, and light sensitivity. So these new findings are important given the increasing exposure to blue light in today's world, and especially now that children sometimes also have a school and use a digital device for studying. So with this, I hand it over to Nick, and I thank you again.
Thank you, Samantha, for sharing those insights. With that, it is time to turn to the question and answer portion of today's webinar. Just to remind everyone, please feel free to type any questions you have into the Q&A box below. Our speakers would love to hear from you and answer any queries you may have. Our first question today is for Ira, and the question is, did mothers become more concerned about nutrition and health in the past decades?
Yeah, that's a great question. And yes, indeed, mothers and parents are much more concerned about nutrition than, for instance, 20 years ago, because their level of awareness about ingredients and nutrients supporting health and wellness is much higher. The reason is quite obvious. Everyone has nowadays basically access to the internet. You have social media, so it's so much easier to really get access to this type of information. And therefore also we at DSM, through our consumer studies, see a clear trend for immunity, cognition and heart health throughout the past years. And last but not least, obviously also COVID-19 is now very much driving the demand for immunity products, but also cognition and so on. I hope I have answered your question. If not, please feel free to reach out to me also after the webinar.
I think we lost Nick. Oh, okay, you're back.
Thank you. So our next question is for Naiman, and the question is, how are the improvements measured in the clinical study related to everyday children's activities in school?
So I think this is a very important question since it speaks to the translation of this work into real-world outcomes. I do think we need additional studies, however, to really understand the meaningfulness of these findings for school-based outcomes or even day-to-day behavior in children. To do that, we'd have to do additional studies that directly measure those outcomes. But I do think, based on previous work that we have done, showing that these tasks that we use in the laboratory, like relational memory, eye position, or flanker, have been previously shown to correspond or predict academic achievement in children. So we anticipate, and this variance explained is typically about 10 to 15% of academic achievement by macular pigmentation. So we anticipate that if the effect size is anything close to that, then even though that sounds like a small number, it could have meaningful effects on children's performance in the school, particularly if you think about letter grades and school achievement.
Okay, thanks for that explanation. Our next question is for Lisa. And the question, Lisa, is with the high increase of screen use with homeschooling, should parents be concerned about blue light in children?
So I love that question for a couple of reasons. I can certainly say that during the pandemic, it suddenly became acceptable for me to take Zoom calls on my treadmill. So if you ever noticed me moving, it was that. If any of you have ever had a call with me and you noticed a lot of movement, I was totally on my treadmill, I won't even lie. I think that we're doing things very differently these days because of the pandemic. And, we are engaging in a lot more screen time. One would actually hope that kids were exposed to more blue light because they were home and going outside on occasion, where there is significantly more blue light than one would be getting off of a screen. That being said, if there is blue light, we do know that macular pigment will protect and screen retinas from that. So that's a really important thing. It doesn't really matter what the source of the blue light is. It matters actually that you have enough pigmentation to screen and protect the retina from it. But I think parents should be more concerned with screen time for cognitive reasons, basically. And so I think that Naiman's data on cognitive control and our data on neural efficiency in children and adults actually is an even more compelling reason to care about carotenoids and sort of learning at home in very, very distraction-rich environments that are in fact blue light heavy as well.
Thank you, Lisa. Moving on, we now have a question that's come in for Samantha. And Samantha, this viewer wants to know, in Europe, is it allowed to use FloraGLO Lutein in children's supplements, and from which age?
Yes, so there is no restriction from a regulatory point of view from the use of lutein, of FloraGLO Lutein in food supplement for children. We saw the importance in our webinar. And also from a safety point of view, the assessment that was done by EFSA in the past established an ADI of 1 milligram per kilo of body weight per day was done, including an exposure of considering the total exposure also for children from the age of 18 months practically, and also the safety assessment on the use in infant established the safety of lutein. So really, lutein can be used in every age, and we saw the importance of using it throughout childhood.
Thank you, Samantha. We now have another question for Naiman. And the question is, are the concentrations in the eye-brain serum related?
Mm-hmm. So that's a really interesting question, and I think that obviously has implications for how we interpret this information. We have limited data on the concentrations in brain in relation to serum and macular pigment. But however, the information that we do have from brain tissue from deceased humans and monkeys shows significant correlations with lutein in the eye and the brain, though the strength of that relationship could vary depending on the region of the brain you're studying. The relationship with lutein in the eye and serum is a bit more inconsistent, even though there's more data available for it. Though most studies do indicate a small correlation, that data is a bit more inconsistent. It's likely due to the fact that when we talk about blood, we're really discussing transient levels of the nutrients. So those fluctuate quite a bit more. But when you look at the concentrations in tissues like the eye and the brain, you expect those to correlate a bit stronger and reflect more long-term status.
Thank you for that. And now we have another question that's come in for Lisa. And this question is, can we say that the sooner we are supplementing lutein in pregnancy, the better is the outcome for the baby?
So that's a great question. So, in a perfect world, what we would want is for women to receive wonderful prenatal counseling, right? That includes good conversations about dietary change, what we should be eating, and the effects on both mom and baby. That doesn't happen in a lot of cases. And so what we found in our research was that supplementing mom was an excellent way of making sure that she was able to deliver that nutrition as early as possible. We also have some preliminary data from our laboratory that shows that moms who are supplementing don't go through this sort of characteristic decline in lutein levels in their own nervous systems that we see among pregnant women. So, at least anecdotally, I can tell you that in our laboratory, that has been an excellent practice. It's one that I also, abided by myself. So when I was having my own kids, so I can sort of tell you that the data seem to be emerging pretty strongly in that direction to say, yes, this is something we should be including in prenatal care. We already advise prenatal vitamins, adding lutein to them would be a wonderful idea.
Thank you, Lisa. I'm afraid that we're out of time for today's webinar. If we didn't get around to your question, we will soon send you an answer by email. I'd like to thank our speakers for being with us today and to everyone who has attended the Chem in Innovation series. As a reminder, all 3 events are available on demand for the next 3 months. Thank you for being with us today, and goodbye.